Good morning, ladies and gentlemen. Thank you for joining in today. Please get comfortable as we wait to start with today's program in just a couple of short minutes. Thank you for your patience, everyone. We're going to begin shortly. Please get comfortable and turn up your volume as we are going to begin in another minute or so. Good afternoon from Toronto, everyone, and welcome to our latest webinar today brought to you by Your Doctors Online. My name is Aisha Nazir, and as part of the marketing team at Your Doctors Online, I would like to thank you for tuning in today. We have a few really great reasons to be gathered here online for the next 40 minutes or so this morning. First, we have the great pleasure of introducing our Chief Medical Advisor and Ambassador of Your Doctors Online to all of you. We are also going to make a very important announcement today regarding our absolutely brand new free membership model that grants unlimited chat services with a family doctor. The service allows you to get responses from physicians, psychologists, dietitians, and veterinarians for a full 30 days, even while traveling, for no charge at all. We will be talking more about this and all the wonderful benefits our membership entails for you and your family after the presentation. To ensure that you get the most out of this session, I would like to introduce the chat functionality before we begin. This is an interactive webinar, and we welcome all of your questions, concerns, and feedback. Please feel free to submit as many questions as you'd like anonymously or otherwise by simply clicking on the arrow symbol in the top right-hand corner of your screen. This will take you to the question tool, which you may use at any given time during the webinar. So without further ado, let me begin by introducing to you Mr. Nauman Jaffer, the founder of Your Doctors Online, and our special guest, Dr. Richard Honaker, the Chief Medical Advisor at Your Doctors Online. As the president and CEO of the Family Medicine Associates of Texas for more than 30 years, Dr. Honaker has been leading private practice family medical clinics predominantly in Dallas, Texas, and Charlottesville, Virginia. He has been managing clinics with as many as 10 doctors in practice under his direction. Over the years, Dr. Honaker has been voted as one of the best doctors in Dallas multiple times. His education, both pre-med and med school, foundationally began at the University of Virginia School of Medicine in Charlottesville. He completed his internship in Ohio and then eventually his residency in Dallas, where he established his practice. He is here with us today to help us discover ways to look younger as we grow older. Ladies and gentlemen, I am honored and pleased to introduce to you Dr. Richard Honaker.
Thank you, and good morning or good afternoon to you, depending upon which time zone you're in. We have people from all over. Just to reiterate, in the top right-hand corner of your screen, you'll see that orange arrow, and if you hit that, you can go to questions, and you can, again, submit them privately or to all attendees. There also will be 2 surveys, just to ask you questions about certain aspects of the topic we're talking about. And the topic we're talking about has 5 parts to it today. First of all, we're talking about Botox, and then surgical ways to look younger as you grow older, laser procedures, fillers and injectables, and then a whole grab bag of other things that you can do, and you've heard about most of these things. So let's talk about botulinum toxin first. We'll just jump right into this. There is a survey. Survey number 1 has just shown up, and we'll ask you to pick your choice there and submit that. I'll give you just 15 or 20 seconds, and then we'll start with the botulinum toxin. Okay, botulinum toxin, mostly known as Botox, but that's a trade name. This is a chemical that is produced by a bacteria, and it paralyzes muscles by working against nerves that go to those muscles, and particularly in the face, of course. Now, these are called neuromodulators, and they're wonderful medications and drugs to help us look younger. There are 2 main types. Botox is one trade name, and Xeomin, X-E-O-M-I-N. Now, these toxins, which are not truly toxic, they're just toxic to the muscles and only temporarily, are mainly for the upper face, the upper half of the face, but they can be used in other spots and even in other parts of the body. The lines that we're looking at, and the lines that are going to concern you as you grow older, are going to be, of course, your forehead lines. You'll have the frown lines when you look down and are frowning and angry. You'll have the surprise or happy lines when you are happy or surprised. And then right between your eyebrows, there are these vertical lines that many people get as they grow older. There are the crow's feet. Nobody likes crow's feet. Then there's the nasolabial folds. This goes from the nose down to the lips, nasolabial folds, and those can really make you look old as you grow older. So there's a lot that can be done there. Then there's what's called the marionette's line, the puppet line. These are the lines that go from the lip down to the bottom of your jaw. It's like if you're old enough to remember Howdy Doody, where his mouth would go up and down like a marionette. Well, that doesn't look so good either. In fact, it looks really bad. And then there's smoker's lines. These are those little perpendicular lines that are perpendicular to the lips that smokers get, but people with a lot of sun damage get those too. Now, there are dynamic wrinkles. These are the wrinkles that are there only when you make expressions, the frowns, the happy, the surprise. And then there's static lines, like the ones between your eyebrows. Those are generally called the number 1 sign and the number 11 sign. I think I have an 11. I'm not sure. Yeah, you all can tell better than I can. But you get a 1 or an 11 there, and those can be worked with pretty well so that you don't have that constant look of a frown and a number 1 or a number 11 right there. Now, who does Botox or Xeomin? Well, a lot of people do. Plastic surgeons do it. Dermatologists do it. There are Botox clinics. Your family doctor may do it. I would just pick a place that you trust and that you know that people have gone there and they've come back with a good result. You've got to really work on that, though, because you don't want to get someone that's not doing a really quality job. Now, the duration of these injections lasts for 3 or 4 months, and they have to be redone if you want the effect. And the cost is generally anywhere from $150 to $300 per treatment. That varies widely depending upon the city and the provider providing the service. Okay, so let's now go to surgery. People know a lot about surgery. Now, surgery is for the aging caused by gravity. Now, wrinkles aren't caused by gravity. They are caused by some heredity, bad habits like smoking and drinking too much sunshine, and just growing older. But gravity is what surgery works on, as well as the other things too. Excuse me. Now, who does this? Plastic surgeons, of course. Dermatological surgeons do this. Now, the plastic surgeons are going to be somewhat more well-trained in the bigger procedures. The dermatological surgeons are going to be more superficial on the surgeries they do, and there are going to be fewer dermatologists that do the surgeries as compared to the plastic surgeons. So you've got to kind of pick and choose there, but in general, if you're going to have anything more than a minor dermatological cosmetic procedure, you really kind of go with the plastic surgeons. There's, of course, the facelift. Incisions are made all around the face, and they hide the lines perfectly well. It looks wonderful. And then the stretch pulls many of the crow's feet and other lines away. And as you've all seen the bad results that are extremely rare, but I think Kenny Rogers had a bad result, a few other celebrities you may be aware of, but in general, this is not a problem, and I would not be too afraid of the facelift, other than it is a relatively big procedure. You're going to be out of action for 2 or 3 weeks unless you don't mind looking bruised and swollen to your friends. The crow's feet can be worked on just individually or as part of the facelift. The downtime for that, if you just do the crow's feet, is minimal. There'll be some bruising and some swelling, but nothing is nearly compared to the facelift. Then there's something called blepharoplasty. Now, this is where redundant eyelids, where the eyelids hang over or droop down. This is a wonderful procedure. If you want to grow older gracefully, get your eyes fixed. I think if you had the choice between good-looking eyes and a bad facelift, or bad-looking eyes and a good facelift, I think you take the good-looking eyes, because the eyes are the windows that people look into and you look out of, and it makes a big difference. So I think looking at your eyes as a way to stay younger while you grow older is much better than just looking at the whole face if you had one choice or the other. You need to be careful with nose procedures. They can run into some problems, rarely, but when they do, it can be problematic. You might have to have another procedure. Sometimes when they reduce the size of our nose or shape it differently, the final result isn't exactly what you want. And of course, it's kind of permanent after you've had that done, and sometimes it has to be redone. Again, that's unusual, but it does happen a little more frequently than the other procedures. And then the neck, where you have the double chin or the turkey gobble thing that they call it, that can be fixed in numerous ways, but there is a surgical procedure for that, and it works quite effectively. Now, these are permanent things, of course, and you have to be aware that you need to pick someone that you know is going to be good. Do your homework on that for sure. Let's talk briefly about liposuction. Liposuction, the way it's been done for a long time, it has some significant side effects. There's a significant amount of bruising, discomfort, and you're out of action, out of commission 2 weeks sometimes. There is something called the UltraShape system, and this is for mainly stomachs, hips, and thighs, and it uses ultrasonic waves that go beneath the skin, sort of dissolves the fat, which is then reabsorbed and goes out of your body. No injection, no pain, no significant downtime, no significant side effects, and it is said that it can erase 2 to 3 inches from your waist in 2 weeks. Now, that's an advertising claim, but I think it's not too far from the truth. 3 sessions are usually done, and it costs about $1,400, again, depending upon your city and your provider. Lasers. I'm trying not to take too much time on each area here, because I want you to have time to ask questions if you have any. Lasers, you hear a lot about, and they are wonderful for what we're trying to do, and that is look younger while we get older. Lasers are good for spider veins, unwanted redness, pigmented spots. They're good for melasma. This is that mustache-type pigment change, hyperpigmentation that occurs in women on birth control pills, hormones, and sometimes just the aging process. Females get unlucky in that respect. Now, you've got to be careful with lasers. I'll go through a few of the different lasers in a moment, but if you use the lasers too aggressively, there can be something called PIH, post-inflammatory hyperpigmentation. And all this means is that the effect of the laser damage, which results in good things, can cause some increased pigment in the skin, especially darker skin, the greater your risk of hyperpigmentation, increased pigment at the site of the laser applications. Now, radiofrequency lasers are wonderful. They heat and tighten the collagen underneath the surface of your skin. That's how they work. It can be painful. There is something called the E2, small e, big T, W-O, E2, which is somewhat better in that it's a non-ablative surgery. It doesn't destroy as much tissue. And you do 3 sessions over 3 months. There's something also called the Titan device, which is an infrared device that firms and tightens the collagen again. This is a huge improvement. It's safer, it's more effective, it's less costly in most cases, depending again upon where you go. And no skin is removed, so there's no downtime. It's a really great procedure. It is costly, anywhere from $500 to $2,500, again, depending on how much you do, and how aggressive you are, and what city you live in. Photorejuvenation. This is intense pulse light, IPL. This is not a laser, but it's akin to a laser. This is good for brown spots, redness, fine wrinkles, capillaries, and birthmarks, among other things. The cost is about $200 to $500 per treatment. And usually there's a series of treatments that occur over several weeks, and then a maintenance every 6 months or so. There is a new one called the Luminous, L-U-E-M-O-N-I-S, I believe is what it's called, Luminous 1. And it's a real state-of-the-art technique. The old CO2 lasers are still used. They cause a significant more damage than the IPL. These are carbon dioxide CO2 lasers. They have a much more dramatic effect than IPL, but there's a big recovery time because you do get a significant discoloration, redness, and swelling. And quickly, we'll talk about Fraxel, F-R-A-X-E-L, Fraxel laser. This is where there's sort of thermal, high-temperature damage that is caused underneath the skin, not damage that's bad, but damage that's good because it tightens things up. The Fraxel is good for scars, dark spots, wrinkles, brown spots, crow's feet, acne scars, any type of surface scar, discoloration, even for stretch marks. The average cost is about $1,600, but you can get it for anywhere from $200 or $300 to $4,000, again, depending upon where you are. It usually is 3 to 5 treatments over 3 to 6 weeks, and there's minimal downtime. The effects can be relatively quick. They last many months, and the maximum benefit is really not seen for 6 months, but it really is a nice, effective way of making yourself look younger. Now, there's something called E-matrix. This is a form of resurfacing. That's capital E matrix, M-A-T-R-I-X. It's a radio frequency energy type technique, and you get 6 treatments for anywhere between $1,000 and $2,000. It's less painful than the other procedures. It's a little less dramatic, but there's definitely less downtime, and it's really kind of the closest thing that you can get to a surgical facelift without doing surgery. This is specifically good for people with dark skin. You get 3 to 5 treatments with a 4 to 6 week interval between the treatments. The average price is $1,225, but again, that's dependent upon where you are. And it lasts, in some cases, many years, up to 8 to 10 years, as long as you have a refresher once a year. Fillers and injectables. Let's talk about those. These are, you hear a lot about these, and these are mainly for the lower face, the nasolabial folds, the marionettes, puppet lines, but they can be used in other places also, and even to fill up around the eyes for people with sunken eyes and darkness there. Now, collagen is the old-timey thing that was always used. It's still used some, but you only get 1 or 2 months out of it, so it's really not that hot. The 2 most common brand names of fillers injectables now are Juvederm with a J and Restylane with an R. These are hyaluronic acid, and they attract water, which helps the tissues get puffier. And that's exactly what you're looking for, to puff out these nasolabial folds, the marionette lines, or even to accentuate the cheekbones. Now, Juvederm is easier to inject for the physician. It's a little less lumpy. There's a few less lumpy side effects from it compared to Restylane, but they're both excellent, and they last 9 to 12 months. The cost is $500 to $1,500 per treatment on the average. Now, a lot of people get their lips done, and women love that sort of pooched out effect, but I'm sure you've all seen people that have a little bit too much there. Well, you can do these injectables, Juvederm or Restylane, in the border. They're what's called the vermilion, which is red, the vermilion border of the lips. And this doesn't give you that sort of pooched out look. Or you can do it in the body of the lips, and have to be very careful and use a physician that is well skilled in this technique so that you don't look too funny and too overdone. This lasts 6 months. So again, if it's overdone, it's not the end of the world. It's just 6 months of looking a little too kissable, I think. Smoker's lines, these little vertical lines, these look horrible for some people as they grow older because they can become very deep and very noticeable. This is a great place for a combination of Juvederm or Restylane plus Botox. And it's going to be relatively expensive, but it does a wonderful job. And then if you just want to get the filler for the nasolabial folds only, that's about $450 in most cases. But again, give or take $100. Side effects of these fillers are granulomas, which are sort of hard, nodular, scar tissue underneath the skin. You can get infections. That's rare. You can get what's called a simian face if you do the nasolabial folds too much because they pooch out, and then you look like a simian look, which is an ape-like look with the swollen upper lip, above your lips there. And then it can get lumpy. You've got to be careful with that. I think if you choose your provider well, whoever does this for you has got good experience and has shown good results with friends, family, and people that you've asked about. I think if you get good testimonials on that, then you're in good hands. But you really want to avoid sort of fly-by-night clinics. And for all the things that we've talked about, you've got to be very careful because for the providers of these services, they are quite lucrative. And there is a tendency in some cases, and this isn't common, but there are those people who churn. It's called churning, and that is just keeping people going on these things. And it becomes a sort of a revenue problem, and it can really drain the bank account because you keep kind of hooked on how good you look. Now let's talk about the grab bag of other stuff. There's chemical peels. Now the stronger you do on a chemical peel, the better your result, but the more you're going to get that hyperpigmentation, especially in darker skinned individuals. This is great for sun damage, wrinkles, fine lines throughout the face anywhere, and acne scars. And then there's microdermabrasion. Now, microdermabrasion should be your starting point for most of the things we've talked about. You don't want to jump right into facelifts and lasers. These are expensive, some downtime. Microdermabrasion is probably the way to start, especially if your problems are mild. It's sort of a sandblasting, a small microscopic sandblasting with small crystals that hit the skin and debride it. They take off the surface of the skin and then suction out the dead cells. There's also a diamond tip microdermabrasion, which works much the same way, maybe a little more expensive. Cost is relatively low compared to the others we've talked about, $100, $120, but you need to sort of price shop on that. There is some recovery time associated. You must be out of the sun for sometimes 1 to 2 weeks after microdermabrasion. So you've got to plan this around beach vacations. Now, it's great for acne scars. If they're fine scars, very fine acne scars, small, you can use aggressive microdermabrasion. If they're deeper, you may want to go to laser. And if they're these ice pick type acne scars, those often need to be excised. So I don't think microdermabrasion is going to do much good for those. And then there's something called microneedling. One brand name is called the DermaPen. This is a cluster of fine needles that punches micro holes throughout the area that's being treated. Now, this increases the texture and elasticity of your skin, and you can get this done at most aesthetic clinics. The downtime is anywhere from a few hours to a few days. And by downtime, I mean redness and swelling. And 5 to 6 sessions is usually what it takes at about $500 per session. For spider bangs, you can use Fraxel, cautery, which is an electrical machine that kind of fries those little tiny spider bangs, and injections with chemicals that cause scar tissue in those little tiny blood vessels. We'll talk briefly here about the turkey neck, this double chin thing. There is a fat dissolver called Kybella, K-Y-B-E-L-A. This is relatively new, and it's good to dissolve the fat, much like we talked about earlier with the sound waves. Single treatment includes a series of injections in that area. It's quite effective, and you usually have 6 single treatments, each one having multiple injections over a 6-month period. And you might look into that if you have this. You can do the surgery on that also, but there are many techniques, and I think you have to sort of choose the extent of discomfort you're willing to go through, the downtime, and of course the cost. And then finally, hair removal. Well, electrolysis is the gold standard there. Electrolysis is permanent, 100% effective, but it's quite tedious and quite uncomfortable. Lasers can be used for hair removal. You may only need 4 to 5 treatments to make that happen. For some reason, hair removal with lasers is not so good if you're a redhead. Don't ask me why, but there's something that you just don't get quite the benefit. It's best for people with dark hair and light skin. And then there's the diode hair removal laser. This is a permanent way to remove hair. This can be done on the upper back, the mustache area, eyebrows, anywhere where there's unwanted hair. And that's a lot of wear for most people, for most women especially. So anyway, that was a quick run-through of the 5 major areas in which we get the best bang for our buck, so to speak, in looking younger as you grow older. And I think, again, if you pick the right person with the right experience, the right machines, and the technique and procedure that you feel is best for what you have, then you're going to do well, and you're going to be happy almost all the time. There's a few complications, but those are rare, and I would say go for it in this case, as long as you've done your homework. So I hope this will help you. I can't see you now, but I bet you don't look nearly as bad as you think you do. And if you do look that bad, well, you can always get better with all these five areas of ways to look younger while you grow older. Now we'll have survey number 2 here. If you please take that, and then we'll open up for questions. Okay, I'll turn it back over to the moderator, and we can field any questions that have come in.
Thank you, Dr. Honaker. That was indeed very informative. I hope all of you enjoyed it as much as I did. Just to remind you once again, please ask us any questions by clicking on the arrow in the top right-hand corner, and you may ask us questions anonymously if you'd like. I would like to continue where I left off by talking to you about the services we offer at Your Doctors Online. Did you know that misdiagnosis and medical errors are the 3rd leading cause of death in North America? Studies at Harvard and Johns Hopkins revealed that up to 12 million people are misdiagnosed annually in the US alone, resulting in as many as 400,000 deaths a year. At Your Doctors Online, we are here to prevent exactly that from happening. Furthermore, we are extremely excited to introduce to you our free membership model. Through this membership, you can access quality healthcare not only for yourself, but also your friends and family. We have kept in mind the main things while, 3 main things while developing this service, and those are convenience, comfort, and time efficiency. As is the case with most of us, including myself, there is often a constant need for engagement with a doctor, as we have a flurry of day-to-day healthcare-related questions, ranging from the commonplace to the confusing. Sometimes we even encounter rare and rather pressing medical problems relating to chronic or acute conditions and need someone to help answer our questions as correctly and urgently as possible. Our goal is to offer convenient and affordable solutions during all such times. Under our freemium membership model, you get the opportunity to a free chat service for 30 days, VIP and preferred access to North American specialists, additional discounts to busy specialists within 24 to 48 hours, access for your entire family under one membership, free storage space for family medical records, free access to assessment tools for breast cancer, diabetes, depression, and many more tools to come, a range of facilities such as weekly health updates and concierge services. I would highly encourage everyone to join now and test our service, especially since it is absolutely free. This is a limited time offer. We will now proceed on to the next segment and answer all your questions. But before we do that, I would like to hand over to Mr. Naman Jaffer so he can give us a brief demo of how you can become a member today.
Thank you so much, Aisha. So real quickly, I wanted to demo Your Doctors Online and how you can become a member very quickly. Our website is yourdoctors.online, or you can type in YDO, which stands for yourdoctorsonline.com. So it takes you to our web page, which you will be able to see here. There's a lot of information here. But what I wanted to actually do right now is basically show you how to become a member real quickly. So all you need to do is basically click on free membership. So you click here, and it will ask you for your email address. You just put in your email address and your password. This phone number is optional. The only use of the phone number is that if there's an update from the doctor, you get a text as well. So let's skip that for a second. You can register with Facebook or through Google as well. So let's say we register using your email. It'll take you to what we call your family dashboard. And what I wanted to actually quickly show you is what it looks like. It's a pane of glass dashboard where you are able to do multiple things. The most important thing I wanted to show you is that you can actually talk to a doctor here. So it's simply start chatting, and you will see that a doctor will actually get engaged and will start to answer. And while that is happening, you can actually also create a case and tell us about your case by clicking, asking the question, uploading the file. If it is a first opinion, then you can actually go and click the next screen. If you want to see a specialist, you can actually select the specialist that you want to see and answer more questions here and go to the next screen. So that's pretty much it. The last thing I wanted to show you is that you can also see that we have our assessment tools for our members as well. So we have actually developed 3 assessment tools right now for depression, breast cancer, and diabetes. So you can take these assessment tools if you become a free member. And of course, I just showed you how to become, to create a case as well. So last but not least, I just did a quick demo, and you can see that the chat service the doctor has entered, and she's here to answer any questions. Thank you so much. I hope this demo actually shows you how simple, easy, absolutely free it is to be able to actually talk to a doctor from any device at any time. I'll hand it over back to you. Before I do that, Yasser, I wanted to actually do a quick survey here. Let me just pull this up. I'll give 20 seconds, and then I'll hand it over to you, Yasser, and then if there's any questions, we can try to answer them. We'll wait another 10 seconds. There's a few people who are responding. And you can choose multiple things here as well to top items that you think would be beneficial for you to join. Okay, so let me close and share the results here. So you can see the unlimited chat functionality that is absolutely free, and the convenience factor that you can talk to a doctor 24/7 on any device. There's absolutely no wait time. Those are the top two features that people like. Thank you so much. I'll hand it over to you, Yasir, to ask any questions here.
All right. Hi, everyone. My name is Yasir, and I'm from the Your Doctors Online team. I'll now be facilitating the Q&A session at the end of our presentation. So once again, I just want to let everyone know that if you hit the orange arrow at the top right corner of your panel, then you can view the questions tab and ask any questions anonymously that will be answered at this time. All right, so I'll be directing the questions to either Dr. Honaker, who gave our informative presentation today, or to Noman, who is the CEO at Your Doctors Online. So our first question is for Dr. Honaker. This question refers to your facelift portion of your presentation. The question asks, how long does a facelift last for?
A facelift is usually permanent. The effects of it do not, you don't return to the sagging and the wrinkling once it's done. Now, if your skin continues to age due to more sunshine, many more years going by, bad habits and that kind of thing, well, you may have wrinkles recur and get worse, but basically the wrinkles and the changes that occur from the facelift remain. Further damage could make a second one needed many years down the line, but most people get by with their first.
Okay, thank you. Our next question is again for Dr. Honaker. The question is, are there any complications about plastic surgery I should be concerned about?
Well, yes, there are. One would be infection, as with anything that requires incisions. But again, we have such excellent techniques and such well-experienced surgeons that, and such clean conditions in the operating room that's really not a problem. Sometimes overcorrection, as we talked a little bit about with Kenny Rogers and some of the other celebrities who've been kind of overcorrected, they get that sort of, stretched look to their face like you're in a windstorm, or just got off a roller coaster. But again, that's very rare. And I think you're going to avoid that by picking an experienced surgeon and by interviewing and speaking with prior patients that he or she has had and just see what their results were. You can even ask them point blank, and this is what I would do if I was going to go in for a facelift. I would ask the surgeon, give me the names of 2 people that had complications and let me talk to them. There's always going to be complications, small complications, but most are very minor. But I think that infection, minor, overcorrection, rare, but sometimes occurs, but that's very rare.
Okay, thank you. Our next question is for Noman. The question is, will my Your Doctors Online membership be free forever?
Thank you so much, Yasir. So for the first, 1,000 members who will be joining, yes, it will be free forever. But as we get more and more members, then we will switch over to our monthly membership fee, but not for the initial 1,000 members.
Okay, thank you. Our next question is again for Dr. Honaker. The question is, why is there such a stigma against medical alterations?
Well, that's a tough question. A good question, but a tough question. Why is there a stigma? Well, I guess people consider this to be vanity, and should we spend our money sending food overseas instead of getting our nose reduced or our eyes lifted and our crow's feet fixed? But I think there's a trade-off there. I think in many people, and especially the effect that culture has on women, self-esteem is a big issue that is influenced greatly by how you look and how you age. And I think if someone has an improvement in their self-esteem, that person becomes a better member of society, a better mother, a better spouse, a better friend, because you feel better about yourself. I think you've got to be careful with that. You don't want to use these techniques to shore up your whole personality. But I think the improvement in self-esteem is important. And the reason for the stigma, I think, is just that. If people think you're being selfish. But I think that's not true. I think it's appropriate in most cases to go ahead with the surgical and other type techniques that you want to do to make you feel and look better.
Thank you. Again, another question for Dr. Honaker. Is laser hair removal a safe procedure? Is it worth the money?
Yes and yes. It's safe. There's minimal, if any, side effects or downtime where you'd have to miss work, and it is quite effective. Again, the electrolysis is the best, but laser is very good, especially with the new techniques that are coming out. And you can use this laser anywhere, everywhere from bikini line to eyebrows.
Perfect, thank you. I'm going to direct our next question to Noman. Is the Your Doctors Online membership a no-commitment membership?
Yes, absolutely. That's one of the features that we have. Besides not charging the monthly fee for our first 1,000 members, it will be no commitment. You don't have to commit for a year or any 6 months or anything that other services do. So you can sign off by simply sending us an email at members@yourdoctorsonline, and we will be happy to end your membership.
Thank you. And another question for Dr. Honaker. What is the best way to cure wrinkles?
Well, I think it depends upon where they are and how deep they are. But for fine wrinkles and the typical wrinkles that people get as they grow older, I think that the first way to start is microdermabrasion. It's going to help some, but not greatly. And after that, depending again upon the site, I think either, and I think tied for second, it would be the injectable fillers or the botulinum toxin type procedures. The problem with those techniques I just mentioned is that they are not permanent, and they last months and months and months, but not forever. So that's where the surgical procedures come in. They are effective for the long term and more costly, therefore, and more downtime. And again, it depends upon the site for what's the best procedure. But you want to start with microdermabrasion, work up with things like lasers and fillers, and then move into surgical procedures if things aren't going well and you're not liking the way you look.
Okay, thanks. Another question for you, Dr. Honaker. Is there a permanent, safe treatment for removing freckles?
Well, many of the techniques we just spoke about, yes, it's permanent. The lasers are good for that and work quite well. Microdermabrasion works somewhat well. It's a more superficial thing, but I think for freckles and spots that are unsightly and want to be gone, I think the laser would be your way to go on that.
Okay, thanks. A question for you, Noman. Why should I become a member if I can register a case when needed?
Yeah, excellent question. I think the key functionality that we're giving for our members, Aisha talked about and I kind of demoed, is basically the ability to actually have unlimited chat. So instead of using Google or WebMD and going and looking for articles, you can actually go and chat with the doctor, with the family doctor 24/7. And we have psychologists and dietitian and travel doctors as well who will be happy to respond to your questions. So that's the main functionality, but as a member, you also get additional benefits like the assessment tools that I showed. You can actually do those assessments at any time. You can store your medical records indefinitely with us. It's HIPAA and secure, HIPAA compliant and secure. There are a lot of other benefits besides storage, assessment tools, unlimited chat. You get discount when you actually create a case and you're looking for a specialist. And we also, by the way, give you VIP or preferred access to those specialists if you are a member. And there's a lot of other benefits, but those are some of the ones that come to my mind right now for becoming a member.
Okay, thanks. We just have a few more questions. The next question is for Dr. Honaker again. Do eye creams or topical serums that claim to help with wrinkles have any anti-aging benefits in reality, or are they useless?
They're closer on the scale of useless than they are on this part of the scale that's for useful. These are money-making machines, I think, money-making creams and gels and serums that may have some small short-term benefit, but they don't have long-term benefit, and the benefit is mild. So I find it a waste of money for people that tend to order these expensive things in mail. There may be some little benefit to start with, but not enough, I think, to allow the expense.
Okay, thanks. And one more question for you, Dr. Honaker. Are there any safe weight loss surgeries?
Yes. Many of them, they're all really safe if they're done, again, by an experienced, accomplished surgeon. Everything from tummy tucks to liposuction, and also there's things like implants, thigh implants, buttock implants. It's incredible the things that we do nowadays to help people feel better about how they look. But I think those surgical procedures are really safe. Now, they're uncomfortable. It's some recovery time, of course, because it is surgery, and they're costly, but they are effective and safe.
Okay, thanks. And a question for Noman. Where are the doctors at Your Doctors Online from? What kinds of questions can I ask them?
Yeah, all of our doctors are board certified here in North America, and you can ask any sort of advice or consultation from those doctors. Of course, they would not be able to give you prescription, but you can ask them for if you have already been prescribed anything, if there's a treatment that you've been given, you can ask them, just like you're asking Dr. Honaker right now about some of the questions out there, right? So, yeah. Does that answer your question, Yasser?
Yeah, thank you. And the last question is for Dr. Honaker. After facelifting, is any specific exercise required for the face?
No. You just wait for the swelling and the small amount of bruising to go down, and it's really not that much bruising, that much swelling. But there's no exercises you have to do other than just I guess massage the areas if they look like they're a little puffy and try to get the swelling fluid to absorb. But you don't have to sit around and make faces and smile and frown and all that stuff. Your body will heal up, and then you'll be right back to where you were, except a lot younger looking.
Okay, thank you. So I think that concludes our Q&A session. Just going to hand it back over.
Yeah, thank you so much, Yasser, and for everybody to join, especially yourself, Dr. Honaker, for the presentation. Aisha, to yourself as well for taking us through the introductions and introducing the free membership, and Yasser for taking the Q&A. Just in the interest of time, we're going to skip the closing survey. We are more than happy to get some feedback on today's survey, on today's presentation, and also we would love to know if what should be the topic of our next webinar. Thank you, everybody. With that, we'll log off. Thank you.